Hello, welcome to this short video about coping with coronavirus. And my name is Brendan Kelly. I'm a psychiatrist in Tala Hospital and Professor of Psychiatry at Trinity College Dublin. I've just written a short ebook called Coping with Coronavirus, and you can find that on Amazon and various other outlets. Coronavirus presents the world obviously with two big problems. The first one is the illness caused by the infection itself, and the second one is the anxiety and the panic that this has triggered around the world. Now, the first problem, the public health authorities and the population and us healthcare professionals, we can all work together, and we are doing so to try to manage that. What I'm talking to you today about is the second problem, which is the anxiety, the panic and the stress. And this applies to everybody, but it particularly applies, I think, to healthcare workers. We are in a uniquely stressful position. So I'm going to talk about four things. I'm going to talk about what we know and how we use information. I'm going to talk about what we think and our thoughts and how we can manage those better, how we can manage our emotions better, and then the behaviours or the actions that we need to do so that we don't forget to look after ourselves at a time like this. So to begin with, knowing or information. It is very important we remain informed about coronavirus, but it is very important that we do not obsess about it. It's very easy to obsess, to follow social media and newspapers and news reports all of the time. So it's useful to limit the amount of time you spend looking at the news or looking at social media. Why not spend just 15 minutes in the morning and 15 minutes in the evening reading about the global or national problems to do with coronavirus? In between times, only focus on it to the extent that it impacts on your daily work. Either yourself, your family, your patients, your colleagues, we deal with the problems. But the high-level problems, leave that to two 15-minute periods, the start of the day and the end of the day. Otherwise, the global picture will just weigh you down for the entire day, and we all have work to do. So that's the first piece of advice about managing our media habits and realizing that too much of it simply leads to speculation, rumour, and we start taking things seriously when we shouldn't. We need to limit how much information we take in, prioritise reliable sources like the World Health Organization, the Health Service Executive, and deprioritise social media. Best of all, delete all social media accounts right now. I'm not certain they help us in any way. So that's the first point, managing our information. The second point I want to make is about managing our thoughts and the way we think. We're all prone to certain thinking habits. One of the most common ones is negative filtering. This is when we focus on bad news and we exclude good news. Now, it can be very difficult faced with something like coronavirus when there's so much bad news. And the media do this too. They focus almost exclusively on that. They often fail to report the small pieces of good news that can provide the basis for progress. So in our thoughts, it's important we don't put on a negative filter and only stoke our anxiety by focusing on negative news. The other way to manage our thoughts, of course, is to watch for what are called negative automatic thoughts. These are thoughts that we think, maybe very briefly, of a very negative nature. So if we fail at something small, we might think, I'm useless. And even if we dismiss that thought immediately, it still has an emotional effect and makes us feel bad. So becoming aware of these thinking habits can really help reduce them and limit their impact on our moods. So I guess that's the second point I want to make, which is about watching how we think and making sure we don't slip into negative thinking patterns. The third point to be aware of is our emotions. Now, a lot of us have very strong emotions right now regarding coronavirus, regarding the spread of the infection, the care that we can or cannot provide, and our struggles to do our best. These emotions can influence our behaviour. They always do. We like to think we're very logical creatures, but in fact we are very emotional, irrational creatures much of the time. We try to focus on the evidence and on logic, but that doesn't always work out for us. So it's very helpful to be aware of your emotions. They might well be influencing how you think and how you feel and how you move through the world. So becoming aware of emotions, particularly our negative emotions, is an important part of learning how to deal with something like coronavirus. One good way to manage this is to practice sitting with your emotions, not responding to them, but just noticing them. So if you find a quiet place, you can sit down for a few minutes and just be there. Try not to think too much about anything, but note your thoughts and note your emotions as they come. And you find very quickly that your emotions will simply dissipate if you deny them the oxygen of your attention. These are all passing feelings. Sometimes they have a basis, much of the time they don't. But if you can find space in your day simply to sit for a few moments and watch what thoughts and emotions come into your head and watch them drift away, that's a very, very powerful way of demonstrating to ourselves that our emotions can be managed and don't have to influence everything we do. So far, there have been three things: managing our information, where we get it and what we do with it and how long we spend reading about coronavirus, looking at our thinking and watching for negative thinking habits, and then learning to sit with our emotions. They have a huge effect on how we think and what we do, so it's good to be familiar with them. The fourth point is to do with our behaviours. At a time like this, we want to work all day and all night, and that's a really good impulse to have, but it's not healthy and it's not helpful for us. So at a time like this, we need to devote particular attention to watching our diet, making sure we eat well, watching our exercise, making sure we get some exercise in each day if at all possible, and watching our sleep. Now, sleeping can be difficult when you're all hyped up and you're working so hard, but that makes it even more important. We do need around 6 or 8, ideally, hours sleep per night. Getting that sleep is important for both physical and mental health. A lot of shifts are changing, timetables are changing, but we do need to sleep. We need to eat, we need to exercise. A doctor who's stressed or ill is no good to anybody. We need to take time for this. The final point, in addition to managing our information, watching for negative thoughts, understanding our emotions a little bit better, and looking after our physical health, the final thought, in addition to all of that, is to do with other people. We all have irrational worries, things we secretly worry about and sometimes we're embarrassed to say to other people. Other people have the exact same worries. And by talking to other people about these things, we're not burdening them. What we're doing is unburdening them by reflecting to them things they've probably worried about too. That's very important now. All of the research about well-being in doctors shows that one of the greatest sources of support are casual conversations with colleagues. Rightly or wrongly, people in any profession feel that the only ones who really understand them are other members of the profession. Supporting our colleagues is so important, and it doesn't need to be formal support. Casual chats by the water cooler, having lunch together, having a cup of tea together, these things are worth their weight in gold to our colleagues and to us. We shouldn't undervalue them. Chatting is more than just chatting. It's a very important source of support from a colleague, the only person who maybe really understands the position you're in. So coronavirus presents two problems: the physical illness caused by the infection and also anxiety and panic. We can manage both of these. Managing anxiety and panic in yourself and others is critical at this time. It's helpful to watch your information intake and to manage that so it doesn't disable you. It's helpful to watch for your thinking pattern, watch for negative thoughts or automatic thoughts that don't help you at all. It's helpful to sit with your emotions and to be aware of them. And in terms of physical well-being, we need to watch our diet, our exercise, and our sleep, now more than ever. And finally, linking with others, especially our colleagues, provides us with a source of support that is worth its weight in gold. So talk to others, but also listen. The old advice is true: if you want to be heard, listen. I talk about a lot of this in my book, Coping with Coronavirus, which you can download, and proceeds from the book are going to medical charities assisting with the global response to coronavirus, and it only costs 99p on Amazon or elsewhere. My main message to you is to take care of yourself so that you can take care of others. That's what we're here for.